For our final project, we wanted to expand upon the course concept of mental health and the intersection that it has with atheists, an underrepresented group. Many religious individuals attribute their ability to get through hardships in life and a positive mental health status to a belief in God. Since the stereotype and stigma is so strong regarding atheism and poor mental health during hardships, we decided to investigate further. We conducted interviews with Autumn Factor, a freshman at the University of Wisconsin-Madison, Father Eric Nielsen, a priest at St. Paul's, and Liz Allen, a hospital chaplain. We also did online research looking at a multitude of studies. We first asked our interviewees to define a mental illness.
Something that inhibits your ability to function in normal society from like a mental perspective.
Mental illness is a disease of the brain that makes it difficult for a person to think normally.
Mental illness. Someone has some thinking that is not serving them in the world of the most people.
Mental illnesses can be defined very differently from person to person. The American Psychiatric Association defines a mental illness as conditions involving changes in thinking, emotion, or behavior that are associated with distress and/or problems functioning in social life, work, or family activities. According to the Mental Health Foundation, spirituality is used in an abundance of contexts, such as a sense of purpose, connectedness, for example to God or others, a search for hope, and activities that give meaning and value to people's lives. They have also found that spiritual belief in any form positively impacts one's mental health, especially with depression, anxiety, post-traumatic stress disorder, or schizophrenia. We found in our interview with Autumn, who identifies as an atheist, where she finds what fuels her spirituality and its intersection with how she finds hope and comfort.
For me and for like a lot of like atheists in general, it's like less about having a defined like purpose and afterlife and that kind of thing to give you hope, and more just about like enjoying the environment around you and realizing that like, you know, you should make the most out of your life and find your own like personal meaning in your life, because you only have one life and you have to make it worth it, and you have to do something like great with it that's important to you. And I think also from like my friends and my family and all of that, like I don't think like any person that's like an atheist would say that they're like down on hope or anything.
So I would say pretty much everybody taps into there's a spiritual component of life in order to get through difficult situations, despite whatever their philosophical or theological beliefs are.
When I ask, how's your spirit doing? People often tell me, oh, my spirit's fine, because I've got lots of support in my life. I'm married, I have a great family. There are reasons.
Definitely like peers and friends and family and everything. Just having each other and being like there for each other and being strong like in yourself, I think is very important too. Like, you know, like I find like a lot of happiness in myself, and even when times get hard, I know that like they'll always get better.
With difficult trials, they reach out to other people, right? You know, so the question is, how do you deal with pain? Right? Is pain something that goes on forever? Does it disappear? I would think that if you're an atheist though and you hadn't come to grips with pain, it could be rather difficult if you didn't think there'd be some reward.
Yeah. We all believe in something, and some of us believe in God and an afterlife, and some of us don't. I'm more interested in how is your belief system working for you when you're sick of body, or sick of mind, or sick in your spirit. And if you have a thinking problem, it often is affecting your body and your spirit. Everyone is spiritual.
Okay.
So they have a will to live and a reason to, and a beliefs about what's going to happen.
Yeah.
And why they're wanting to be alive. Oh yes, people use religion to feed their spirit.
Okay.
So religion is subservient to the spirit.
Okay.
But not everyone is religious, and nowadays many people aren't.
From like an atheist perspective, there isn't really like a justification for like why bad things happen. or like why good things happen. It's just kind of like, you know, they happen. Like, you know, if you work hard and you do your best on the exam and the exam goes well, like that's your own work and you should be really proud of it. But like, you know, on the other like side of things, like sometimes there are random things that happen, like random good things. It affected it in any way. I would say it's in a positive way, because I think like I just learned to appreciate life a lot more. You can really appreciate life and just like make the most of it. I mean, you only have one, and like some people I think that atheists are really sad because they think like, oh, like you must be scared to die and like you must be scared of like the afterlife or whatever.
This is how anyone feeds their spirit. They get up in the morning for something. Their life is worth living. And so everyone is about, was their life purposeful and meaningful by their own definitions? An atheist is as likely to become mentally ill as anybody else.
Autumn fuels her spirituality through her family, friends, and her purpose for life. Dr. Gallant, a psychologist of Grand State University, found that unlike previous studies, the highly religious and the completely non-religious were very similar in their mental health and general well-being. It was the religiously unsure who were at greater risk for mental health problems and reduced well-being. This was a conclusion we found prevalent among many studies, and Liz Allen also agreed.
And we did a study at St. Mary's for just only 1 month, actually, and on 2 units, we had nurses ask every patient when they took vitals, how is your spirit doing? And ask them, when a patient said they had a 4 or below, that they should write us chaplains and say, see this patient, because they have a low spirit. Because if their spirit was stronger, they'd probably do better.
After sifting through studies, we noticed many biases. For example, many of the studies were performed by atheists or religiously affiliated individuals, with results in favor of their belief. Additionally, many of the non-religious categories were extremely broad and vague. People who were rated high in religiosity only clarified beliefs were present, not that the belief was strong or weak. From the inconclusiveness, we cannot say that atheism or religion causes an increase or decrease in mental health status. However, there was one key concept throughout all the studies that held true. The largest determinant of a positive mental health is having a strong, unwavering belief system, whether it be a religious or non-religious belief. The strength of a belief will feed one's spirit, which will, in turn, either have a positive or more negative impact on mental health. When religious and non-religious are firm in their beliefs, they have a higher mental health outcome. With a lack of commitment, the religious or non-religious involvement may become detrimental to one's mental health.
2 other determinants of mental health also have a religious influence. The benefit of belonging in community and a coping outlet for hardships is found in religion. Studies show that religious involvement is associated with better physical and mental health. Through religious attendance, a community and sense of belonging is formed, which increases mental health positively. Secondly, religious coping is the most powerful predictor of recovery and survival. People who use religion as an outlet are able to cope and recover more quickly. When it comes to hardships, although many religious find their outlets of comfort in religion, atheists find community and coping mechanisms in other forms such as family, friends, and counselors.
We learned everyone has spirituality regardless of their religious or non-religious affiliations. In the article, Religious Roots, it states the practice of nursing has shifted from religiously affiliated to a secular occupation. This shift has created interactions from being based on care for love to care based on an economic transaction. Along with that shift, and the fact nurses are understaffed, nurses often do not provide spiritual care. As future nurses, it is essential to remember to care for the spirit everyone is fueled by. We also learned about our own personal biases and how we can work to diminish stereotypes we may possess. We aspire, as nurses, to always provide culturally congruent care, and these interviews have provided us with the information to combat microaggressions and educate others about religious, non-religious, and mental health stigmas.